And our last polling question of the day. How would you rate the quality of healthcare for mothers and families in your community? 1, exceptional, 2, adequate, 3, lackluster, or 4, I don't know. And let's see the results. For a conversation on the health of moms everywhere, please welcome Christy Turlington Burns, the founder of Every Mother Counts, here with the Atlantic's Allison Stewart.
We did not call each other this morning about our outfits. Thank you so much for being here, Christy.
Thank you.
When you go to Every Mother Counts website, and I encourage you to do so, there's a very, very clear and stark statistic. Around the world, every 2 minutes, one woman dies as the result of complications from pregnancy and childbirth. That's one woman every 2 minutes. When you break this down by countries, by rank, the United States doesn't fare well. Will you share the United States rate globally?
It's true. Too many women are dying around the world. But in this country, we are the only industrialized country with a rising maternal mortality rate. In fact, that maternal mortality rate has been on the rise for 2 decades or so. We're doing badly. And people are starting to pay attention. I've been advocating on this issue for a long time and talking about the global as well as the domestic, because I like to think of them as us as a part of the globe. And it's just interesting to see some of the global statistics come down so much and ours on the rise.
What's contributing to the rise in the United States?
So many things. I would say, chronic health conditions, diabetes, obesity, hypertension, those are very much on the rise. The precariousness of our healthcare system, the fact that so many people fall through the cracks and are not accessing healthcare that is their right. Mm-hmm. I would say in some instances, over-medicalization is also contributing to the high instances of maternal mortality and morbidity. And race. Mm-hmm. There's more of a conversation. It's always been there in terms of the data, and the Department of Health here in New York City has been looking at this for some time. However, through a lot of reporting through ProPublica and the New York Times and other articles, The Atlantic, we're starting to see more that you can't just sort of say, and racial disparities. It's clear that in this city, Black women are 12 times more likely to die from complications related to pregnancy and childbirth as white women. In the state, we're doing terribly too. We're ranked 30th in the country. But this city has been above the national average for 40 years.
You've been in this space for a long time. For almost a decade, you've been working in this space, and you've been interested and invested in different ways. Christy made a documentary called No Woman, No Cry. And in the beginning of the documentary, you share your personal story. There's really it's lovely footage, and you're pregnant, and you're happy, and you look like an expectant mom, happy someday, and some days you just want this kid out. And then suddenly you become aware that your own health is in danger. Do you mind sharing the rest of that story?
Of course. So I became a mom in 2003. My daughter is now 15 and a half. And after a otherwise normal pregnancy and delivery, in fact, I had a postpartum hemorrhage after I delivered her. And luckily, I was in the right place at the right time. I had a great team of people, a midwife, a doula, a backing OB. I was in a birth center in New York City in a hospital. Birth centers are now closing, so there's very few of them, and they're not accessible either, but I felt very, very supported and safe. But the complication that I experienced is not as uncommon as I thought, and I felt ill-prepared for what happened. And in the days that I was recovering from this complication, I learned from other women, just in sharing my story, that that it is quite common. And then I also learned that around the world at that time, the global estimates were more than 500,000 girls and women dying each and every year, and that those numbers hadn't changed. So I was just shocked to have gone through an experience, but through that experience to learn the scope of this issue. And it just made me want to learn more. And the more that I learned, the more I felt compelled that I had to do. So the film was one way of digging deeper, looking at barriers to care for women in Tanzania, Guatemala, Bangladesh, and here in the US. And I also went back to school to study public health at the Mailman, at Columbia. And then those two paths led me to start Every Mother Counts.
It's interesting in the documentary, there's this moment, and it makes you realize how important a small thing is. One of the women can't get care because she just can't get transportation. It's a $30 cab ride. Stands between this woman delivering a healthy child and also surviving the birth of her child. A $30 cab ride.
That's right, and that's in sub-Saharan Africa. So distance is a huge barrier, and we talk about it a lot as an organization, but distance is not only measured in miles. In this country, due to some of the hospital closures that we heard about earlier from the mayor, in Washington, D.C., for example, hospital closures have made hospitals that low-income families and women used to have access to no longer do. And so maybe just a mile or two down the road, suddenly that hospital that you've had all your children at doesn't accept Medicaid or turns you away or is just simply closed. So the distance barrier is a really critical one, but it's one that initially I thought was only for rural areas, only in places like sub-Saharan Africa. And then you look at this country where we have a lot of rural populations and communities, and women are living very, very far away from healthcare or the higher level of healthcare should they need an emergency obstetric procedure or intervention.
You mentioned it earlier, and I was going to brag on you. So you have a successful career, professional career, and then you go back to school, and you graduate from NYU, cum laude, by the way. And then you go and get, you learn, you're at public health school for public health, excuse me. What did you learn? Were you able to put any of your education, what you learned in the classroom, to work with your organization?
I would say every life lesson has sort of helped with the running of an organization or a nonprofit. I think the most valuable lesson that I've learned from every different career and every learning opportunity has been the value of relationships and how important it is to cultivate relationships and to stay connected to people. There are people that I knew from my first career in the fashion industry that are very much involved in the work that I do now, that support the work that we do, that support it at a global level, at a local level. That's integral, and it's been so important and meaningful. And then also with the media, those relationships have also been really helpful and fruitful for me.
From when you started working in this field to today, what's changed the most, let's say positively, and then what has been a persistent, stubborn issue?
Well, I would say, again, there's good news in the sense that the numbers are coming down globally and that the world is paying attention. This is an issue that isn't as sidebarred as it was when I first entered it. The bad news is the U.S. is getting, the rates are going up. However, this increased attention, and I would say Every Mother Counts has played a huge role in that, has helped. Like, people are paying attention. This is an opportunity and a time when we can make some serious change. 2018 was an unprecedented year for legislation on maternal health. There were 7 bills that went to Congress. 2 of them were passed at the very end of the year. There are 2 new bills that have been, or 2 existing bills that have been reintroduced, one by Senator Gillibrand, one just the other day from Representative Kelly and Senator Durbin. There are 3 of our presidential candidates who have their names on bills, which were introduced recently as well. Cory Booker, Kamala Harris. These are very exciting times for this issue. And I think all of them collectively touch on this issue in the most comprehensive way. Some of them are stronger than others, of course, but it's a good indication that, that we can make some change.
What's been stubborn? What's been tough to move?
Well, the disparities, clearly. ACOG that's the American College of OB-GYN, they have introduced these safety bundles for the various issues that are the contributing factors to maternal mortality here in this country. So postpartum hemorrhage, disparities is one of those bundles. So they're trying to equip and train hospital staff to manage emergencies. And when you bring in disparities into that conversation, what you're doing is you're talking about patient safety and listening to patients, listening to Black women, listening to women of color who don't often have the voice in our institutions, and taking supporting those women in those times. So I think seeing some of those changes is also really exciting and interesting, and we should see some differences here at the local and state level in New York. There's a lot of exciting things happening. Governor Cuomo initiated an initiative at the end of 2018 that just started in March, which is bringing doula care or a Medicaid pilot into practice, and we're working to help make sure that that's implemented the right way, bringing more community members into those conversations so that we're addressing the communities that we're trying to serve, their concerns and their needs. That is so critical. And I think there's an appetite to listen and an appetite to do what's right. We just need to keep saying the same things and repeating them and sticking on it.
A lot of people, when they hear about these numbers and they hear about this issue, they think, well, what can I do as an individual? What can someone do as an individual?
I think it's really important for us to share our birth stories, positive or when they think they don't go wrong. We're a consumer-driven society, and so when hospitals get a reputation for bad outcomes or too many cesarean sections or or disrespectful care, those messages they carry, and we can, in some instances, some of us more than others, obviously, we can take our business elsewhere. Usually when people have a child, the hospitals expect them to have a second child, and so they're concerned with patient satisfaction, and I think reputation, certainly reputation, but asking the right questions when you find yourself pregnant, and really important to go into pregnancy planning it, being in your optimum health. And then when you start to meet people and think about who you could work with and who will deliver your child, who will care for you, knowing that you have options. In this city, you have options. In this country, you should have more options. But when you do have them, you need to exercise those. And then sharing that, what works. Doulas are an incredible resource. So seeing more of these pilots and seeing the city sort of pick up on understanding that doulas make a huge difference in birth outcomes, in postpartum depression, in full-term babies, in just the support and psychosocial support of a woman. So having more access to them, I think, is critical, and for people to know that they're an option and they can advocate for you and help you to make the choices of where to deliver and who to deliver with, they really can make a big difference.
I'm going to open up to questions in just a minute. What about for women who don't have economic and social capital, who don't even know what a doula is? How do we reach out to those populations? Because they are the most vulnerable.
Yes. So doulas are in many parts of the country and oftentimes are serving the most marginalized communities. Oftentimes they're coming from the communities themselves, which I think is critical in access and being the link to the next level of care. Here in New York, we have a partner that we love, Ancient Songs Doula Services, run by Portia. I'm blanking on her name.
Rossi?
No,
Portia.
No, she's a doula. I can't believe.
Could be.
No.
Ellen, they do a lot of work.
Not at all. That's a complete brain spasm. But anyway, she's an incredible person who's teaching and mentoring doulas, and it's really important to have more doulas trained so that more people have access to them. Right. But yes, there's a lot of education that needs to happen in the communities too, to know that this is even a service that could happen at the moment. It could be a self-selecting service, or if you happen to be lucky and be in a hospital that has a program or a partnership affiliation with a doula, they might match you with one, but oftentimes they work with sliding scales, and the point is to make sure that the people who need them the most have access to them. There's a number of them all over the country, and we try to be a resource at Every Mother Counts for some of those doulas, and we want more of them, and we want them to be reimbursed, because Medicaid currently does not reimburse them in states other than Oregon and Minnesota, and so we need to make a difference so that those people are also compensated for the work that they do and the outcomes that they improve.
Your organization is also now providing grants, correct?
Yes, since 2012. We've given about $6 million away so far.
Towards what?
Towards things like transportation, things like supplies, skills and training. We train a lot of midwives, a lot of doulas, a lot of continued education with OB in low resource parts of the world. And we really invest in community leaders who know their communities, know the needs of their communities. They're doing what works. They're implementing models of care that are effective, that are evidence-based, and they just happen to be small and need a little bit of a boost. And so Every Mother Counts has really been investing in those types of organizations, grassroots, fairly small, in the US, in Haiti, in Guatemala, in India, Bangladesh, Tanzania, and Uganda.
We have time for one question right here. Hi.
Good afternoon, Christy and Allison. My name is Lippy Roy, and I'm a physician who specializes in addiction, mindfulness, and nutrition. And I'm also on faculty at NYU, where they spoke about, I went to a grand rounds where they were talking about the rising rates of maternal mortality, which you point out, which is a marker of the country's overall health. And it's directly related to my line of work, where it's not unrelated that longevity or life expectancy is actually declining in the United States, and a large part of that is substance use. And I'm wondering, people are really stigmatized when it comes to addiction, but particularly pregnant women who, they are highly stigmatized if they use, and in certain parts of the country, they're incarcerated because of their addiction rather than getting care and treatment. So I'm wondering if your organization does any work in helping connect women to really the treatment that they really need and deserve. Thank you.
That's a really good point, and it's been coming up a lot more in conversations like this. I think our Every Mother Counts doesn't necessarily address that particular issue, but in us supporting the doula-based work and the midwifery model of care, these are two levels of health care providers who would address all of those things, right? They give comprehensive care, it's respectful care, it really centers around the woman themselves. So the idea is not to shun people or send them away and out of the health system. The idea is to invite them in, not only because they're pregnant, but this is an opportunity oftentimes where women may care about something bigger than themselves for the first time ever, and it's an opportunity to address their whole self and the health and well-being of them for the rest of their lives. And so I think it's a really important thing that you raise. I know in previous years, the concern was if someone was taking some kind of medication and became pregnant, and that was, is it harmful? Is it not harmful? And the conversation has gone back and forth, and it's very confusing for a woman, I think. Now, when you're talking about opioids and you're talking about marijuana-based products or medications, it's a different kind of conversation, but it needs to continue, and we need to figure out and help women understand. There are situations in states where women says, I'm pregnant and I smoke marijuana. What do I do? And they may take her child away. That's not the goal here. Keeping families together, critical in every issue. But in this particular one, I think we need to do more, and we need to help educate women about what the true dangers are, and also what are the risks about being more candid and open about what she's going through and what she's experiencing, and then help to provide those resources when she needs them.
I know at Vanderbilt University and UNC specifically, they're dealing quite a bit with pregnant women who find themselves addicted to opioids, because very many times OBGYNs won't take them on because they're high-risk patients. And there are a couple of clinics at some of the universities that are really doing some great work in this field. We're out of time, but I have one more question for you. I love your board. Your board is full of all these heavy hitter women, like the vice president of global communications for CNN and the CEO of Minted. Was it intentional to have this sort of heavy-hitting female board? Or it just happened that way?
I went to a conference, and they were talking about how to build a board, nonprofit and for-profit. And I probably did something you're not supposed to do, but I reached out to people that I knew, or I reached out to my community of women, of moms. The first 5 people on the board were all moms. Some of them I met, Allison, for example, because our girls were best friends from 6 months or something like that. So I happened to have great access to a lot of women in a lot of different fields, and so I started to talk to them. They were interested naturally in the work that I was trying to do with Every Mother Counts. Many of them have companies that either produce or manufacture in some of the countries where we've been investing in, here in the U.S. and abroad. Some of them lived outside of the U.S. and so had particular interest in certain places. And a lot of them were just, how can I help and what can I do? This is one of those issues when people start to learn the facts and they're exposed, they tend to say, what can I do? And so luckily, as I was starting out and I was looking for people to help support me, I was able to ask, and people were responsive, and we're starting to continue to grow that now. And they are amazing, and I love that their relationships together, that's just been like an unintended consequence, but a beautiful thing to watch, that a lot of them partner together in various ways. They really help each other. And as a group, they give me so much support, and it's been really, really critical as we've been growing and evolving and trying to be the most that we can.
Well, Christy, thanks for the work you do.
Thank you.
It's good to see you again.
Thank you. You too.